Hello and Assalamu alaikum. Ultrascan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the bone density around the teeth. On the panoramic view, you can very clearly see that we've got periodontal disease present in the patient. Now, we'll show you the transaxial view so you have a better idea. Starting from the top right, the second molar, as you can see, PDL widening can be observed right here. Is significant PDL widening. This can also result in the sinusitis that the patient has. Moving to the first molar, again, you can see significant PDL widening in the first molar as well. Even the furcation area is involved. The parietal root is also involved. So we have significant PDL widening here in the upper right first molar. This is the interradicular bone. As you can see, interradicular bone has vertical defects as well. So this patient has generalized bone loss. We've got PDL widening and periodontal loosening here in the upper right second premolar as well. As you can see very clearly that the tooth is loose in the socket. We've got bone loss on the parietal aspect as well. Moving to the upper right first premolar, we've got this is the upper right first premolar. Relatively better, but we do have slight bone loss or PDL winding in the parietal aspect. This is the interradicular area, and then we've got the canine. Canine looks appropriate. So does the lateral incisor, and then the central incisor. Less PDL winding and less bone loss, definitely. Moving to the upper central incisor, better bone stability. The lateral is good, the canine is good. The first premolar has a class 5 region with bone loss present here as well. This is the second premolar, better, but this also has PDL widening, not as much as the right side. You can also see sinusitis again on the left maxillary sinus as well. Again, very significant angular bone loss between the 5 and the 6. You can see the bone levels have actually completely disappeared. This is the mesial root of the upper left first molar. Again, significant bone loss here, significant bone loss on the palate. So this tooth definitely will be grade 2 to grade 3 mobile because of severe periodontal disease. This is the interradicular area between the 6 and 7. Again, significant bone loss here as well. And then this is the upper left second molar, PDL widening, periapical reducency, sinusitis, and again PDL widening on the parietal aspect. So this tooth again also has significant periodontal disease. The lower jaw, however, is doing slightly better. We've got less periodontal compromised teeth. The interradicular area is not as bad. Neither is the interdental area. So the lower teeth posteriorly have better bone support. The lower teeth anteriorly do have some calculus and some periodontal disease, but not as significant as the upper posteriors. So this is what we have seen in this patient's CBCT. The bone quality is poor in the upper posterior jaw bilaterally because of severe periodontal disease. And as you can even see on the 3D rendering, we've got thin fenestrations in the bone due to, and you can see angular periodontal defects and bone loss due to periodontal disease. Thank you very much.